Good evening. Thank you. Thank you for your kind welcome, and thank you for being here. And I'm sorry that it's so long, and I hope you're thoroughly brainwashed now that it's over. And I'm glad to see all of you, and thanks for the opportunity to spend a little time with you. I do spend quite a bit of time here in this wonderful state, and one of my great and distinct pleasures was attending the Iowa State Fair this summer, where I had a pork chop on a stick, which I know is one of the local delicacies, and followed by a deep-fried Twinkie. But probably the best part was meeting the 1,203-pound prize-winning pig named Big Red, who I was very impressed by him. Not to mention the runner-up, whose name was Corn Dog. So I'm glad to be here with all of you. Anna Larber is here, our county treasurer. Anna, is she? Oh, hi. How are you? Thanks for being here. Thank you for coming by. And Phil Wise, our state rep. Where are you, Phil? Thank you. Thanks for being here. It's good to see you. Thank you.
I'm not Henry County state rep. I'm from the county south.
Well, thanks for being here. I appreciate it. And School Superintendent John Roeder. John, is he here? Oh, thank you, John. Thanks for being here, and thanks for all you do. And County Supervisors Mark Linden and Gary C. Mark Linden and Gary C., our county supervisors, are here. Thanks, guys. Thanks for being here. Thank you all for coming. I'd like to mention some issues with you very quickly and then respond to any questions or comments or insults that you might have. I've been asked by the Arizona Chamber of Commerce to mention that the temperature is now getting down into the 80s, and we look forward to your upcoming visit this winter and in Phoenix and Tucson and Sedona and other areas. So we're glad to see you. And today I gave a speech at the Des Moines Rotary Club on healthcare. When I travel around the country and at places like New Hampshire and South Carolina and here in Iowa and other places, and in my home state, the war in Iraq is the dominant issue. It seems to be the one, obviously, that should be, because we have young Americans in harm's way. But the most important domestic issue is health care. And you probably know that every candidate just about who's running for president has a proposal to cure the health care illnesses. Well, I have a different idea than the others in that I think the problem with health care in America today is not the quality of health care. I believe that it's the cost of health care. And I can show you statistics and figures that show you the skyrocketing costs of health care are what is the root of our problem. The quality of health care is not the problem. In fact, if you see whenever some rich person who lives in a foreign country gets sick, they come to the United States of America to get treatment. And obviously our doctors are the best trained. We have the technological advances are made in healthcare primarily in the United States of America. Vaccines are invented here, et cetera, et cetera. And I don't think that the government ought to take over healthcare in America. Every time I see the government take over something, it gets awfully expensive and usually inefficient. And when I view FEMA, we all know about FEMA, and we know you're doing a great job, Brownie, remember? Then I worry a great deal about government taking over healthcare and being able to control costs. On the front page of USA Today about 3 or 4 days ago was the headline banner, Medicaid inflation skyrockets again. And it showed that Medicaid cost inflation last year was 10%. Well, if you get 10% inflation in Medicaid, my friends, there's going to be no health care in the world that's going to be able to stand that kind of inflation. So the ideas that I have are that we keep health care costs down, and we do it through competition, and we make health care affordable, and we make it available, and so that more and more Americans can take advantage of it. And by the way, I don't say that every American has to have health care, health insurance. But I do say that every American should have the chance and opportunity to have available and affordable health insurance. Now, one of the things I want to do is give every American a $2,500 tax credit, a family $5,000 tax credit, and let them go any place in America and get a health insurance policy. Now, right now, you can't go outside of the state of Iowa to get a health insurance policy because you are prohibited from going. Maybe in Arizona, there's an organization that has a better health care insurance policy that you might want to take advantage of. You can't now. And I think that if it's your $2,500 in taxes, or $5,000 in case of your family, you're going to be pretty careful. You're going to be pretty careful about what health insurance plan you want to adopt. And now, the way it is now, the employer is the one, as you know, who assumes that responsibility, and you have no real investment in it. We need medical malpractice reform, my friends. We need it. We need it rather badly. We need to be able to allow people, if they want to go to Canada and buy their prescription drugs, they ought to be able to. And we ought to have drug companies compete for the Medicare prescription drug program so that people can get the lowest cost. And I think that there's a number of other things. Right now, if you have a bad cold, and this has happened to probably a lot of people in this room, you call your doctor and you want to see him, and he says, I can't see you till next week. You ought to be able to go into a walk-in clinic. You ought to be able to go into a walk-in clinic and see a physician there who will give you the cold medicine or whatever it is that you need because you were unable to see your regular doctor. The phrase for them now is walk-in clinics. In fact, I'm told that Walmart wants to put these in Walmarts. And so what does that do? That keeps you from having to go to the emergency room. Any physician will tell you, any healthcare expert will tell you the most expensive healthcare in America is in the emergency room. So you wouldn't have to go to the emergency room. You could go to one of these walk-in clinics and get the care there. Transparency. I'm sure you saw the headline on the Des Moines Register yesterday, I believe it was, where the Attorney General is suing the pharmaceutical companies for, guess what? Overcharging Medicaid for pharmaceuticals. I think most of you know about that. Okay, how were they able to get away with that? Because they didn't reveal their actual costs. They didn't tell their actual costs of the drugs to them, so they vastly, according to the allegations, they have the right of innocence until proven guilty, but according to allegations, that they decided to vastly overcharge for pharmaceutical drugs for Medicaid here in the state of Iowa. Who eventually pays that when they overcharge, my friends? You do. And so this is probably, and also, by the way, so there's got to be complete transparency, not just in the cost of drugs, but in the records that doctors keep, the medication that they prescribe for you, the degree of success that they have. And today, this is really revolutionary, my friends. Today, when you go to, and you're ill, and they'll charge you, and doctor will be paid by Medicare or Medicaid for an MRI, for a CAT scan, for an inoculation, for an examination, whatever the procedure is, there's a card charged to the taxpayer. Why don't we have a situation where they are paid by how well you are? If you have a chronic disease, such as heart disease, or chronic illness such as heart disease or diabetes, why don't we pay the doctors for taking care of you for a year? And whether you're well or not would depend on what the doctor or the medical care facility what payment they would receive. Why don't we do this? Why don't we do that? And it's all aimed at getting better quality health care to Americans and at lower costs. And there's not another, from what I'm told by the experts, I haven't looked at everybody's plan, but I'm told that is the way that this proposal is far different from any other. And if anybody thinks the status quo is satisfactory, then I would be glad to show you the chart.